Everyone at some point in their lives has heard about the lobotomy. Whether intentional or not, when people speak about famous surgical procedures, the lobotomy always comes to mind. The person accredited with the invention of the lobotomy was Portuguese neurologist Egas Moniz, who created this procedure in 1935. Moniz created the lobotomy as an effort to treat mental illness in patients. He wanted to sever the tissues of the frontal lobe because he believed that if the connection between the frontal lobe and the rest of the brain was damaged, stimuli that caused impulsive behaviors and other things would not reach the frontal lobe, and individuals would therefore not have those negative behaviors. Moniz did the first lobotomy by drilling holes into a person's skull and inserting pure alcohol into the frontal lobe to damage that part of the brain. After gaining worldwide attention for his procedure, other countries began adopting the lobotomy, one famous country being the United States. On January of 1946, an American psychiatrist named Walter Freeman did the first ever transorbital lobotomy in the United States. This procedure had the same goal as Moniz, but was done differently because the first one that Moniz created used pure alcohol, which would be too radical for the United States. Therefore, the United States created the transorbital lobotomy. This lobotomy was widely used in the United States in the 1950s to treat mental disorders, but it is not performed today because of the dangers of it. The transorbital lobotomy was performed by having a patient lie wide awake in a table. An instrument known as the orbitoclast, which is a long, skinny pig, would be placed above the eye socket. With a hammer-like instrument, the long pig would be pushed into the eye socket. Once the eye pig was inside the eye, the doctor performing the lobotomy would move the pig left, move it back to the middle, then hammer the pig further. After that, the pig would be moved to the right and then to the left, and then finally up before being returned to its final position. This movement clearly damaged the frontal lobe of the brain. Like I have said, doctors believed that by damaging this frontal lobe, people who had mental illnesses would not have them anymore because they wouldn't get the message from other parts of the brain. A specific part that the doctors focused on damaging was the connection between the frontal lobe and the thalamus, which is an area near the middle of the brain that is responsible for allowing connections between different parts of the brain. In order to understand the doctors and why they damage these parts of the brain, we need to understand their functions. The frontal lobe is the front part of the brain that is responsible for things like impulse control, planning, and voluntary movement. The thalamus is simply responsible for sending the signals to the frontal lobe. When this frontal lobe was damaged, however, so was the many things that it's responsible for. As a result, many people who had the transorbital lobotomy would become impulsive, irrational people who couldn't control their actions well, and who would be unable to make things like planning. This is why the transorbital lobotomy is so controversial. Instead of treating a person's mental disorder, a person would be left worse than they were before. A person's free will would be torn from them because they couldn't control their actions due to their brain. There was also another big problem with the lobotomy. Many doctors perform lobotomies on people with real mental issues, such as schizophrenia and even depression, but they would also perform them on perfectly healthy individuals. These individuals included gay people, distracted people, and even daydreamers. At the time, many people believed that these things were mental disorders, but they just created a new problem for healthy individuals. This shows why the lobotomy is one of the most famous medical procedures, but also one of the worst that should never be performed ever again.